presentation of 13ABC Action News. Now, your table is ready. Join 13ABC's Jeff Smith with the decision makers of Northwest Ohio and Southeast Michigan. This is the Roundtable.
Thanks for being here on this Sunday afternoon. We appreciate you spending some time with us here on the Roundtable. Want to open a discussion today talking about drug addiction. Obviously, in the last week, we saw the loss of Philip Seymour Hoffman, Hollywood actor. All signs point to the fact that he was using heroin at the time of his death, found a syringe in his arm, but it brought the conversation back to light about drug addiction and where heroin is having an impact not only in our nation, but here in Ohio. In fact, as early as last November, Attorney General Mike DeWine was here in Toledo. He was making a statewide tour of a number of different locations, getting out the message that heroin is a problem. In fact, he used the phrase epidemic. He used the term epidemic in describing it here in the state of Ohio. I want to introduce my guests, both from Harbor, joining us today. Lisa Beatty and also Marcia Dries from Harbor, treating the signs and symptoms of addiction and problems in the community. Thanks both for being here.
You're welcome. Thanks for having us.
You guys here, obviously, when you have somebody notable like Philip Seymour Hoffman die and it being linked to drug addiction, it brings it to the forefront. But why heroin is not going away? We are hearing about it again and again and again.
Well, you know, in the world, the top three drugs, you first have tobacco, alcohol, and prescription drugs. And what we tend to see in our work is people start out with the prescription drugs, maybe for a legitimate medical reason, maybe not, but then they progress to using heroin via IV because they want a more intense high and a more intense experience. So, you know, if you follow what happened, sadly, with Philip Seymour Hoffman, you know, it's alleged that he had relapsed after many years of recovery into using prescription drugs. Right. And then from there, progressed into using heroin.
He became a good story after beating the addiction, if you will, and then all of a sudden a relapse, as you said. Look at the fact that we are calling it an epidemic, or the Attorney General here in the state of Ohio is calling it an epidemic. A fair assessment?
Absolutely. I mean, we really have, right within Northwest Ohio, Southeastern Michigan, we have quite a huge issue with heroin. And it will defy your beliefs, whatever your perception of a drug addict is. These are seemingly healthy, young, preppy kids, largely, that we see, who are coming in with full-blown heroin addiction. And it's not for them anymore about getting the high, it's about surviving. Because once you get caught up in the throes of that addiction, daily you need to take your drug to alleviate that pain. So they become hooked, and it becomes a real deadly experience for many.
Lisa, she was bringing up something as far as the ages are concerned, and the scary statistic, I found one report that said back in 2011, 4.2 million Americans over the age of 11 had tried heroin at least once. 4.2 million Americans. An estimated 23% of them will become addicts. You are a licensed independent chemical dependency counselor. When you see this come back up in conversation, your reaction this week when you saw that story come out?
My reaction this week, I wasn't surprised. Because heroin is such an epidemic, and it's really hitting the younger population. We see a lot of the young kids, 18 to 30, some even younger in high school, 14, 15 years old, that have tried heroin and become addicted to it.
So we shouldn't have tunnel vision this afternoon while we're watching this program or talking here on the set about the fact that it is most likely in our schools in this region, or kids. Now, I don't want to say in the schools implicating any districts. I just want to point out the fact kids, you believe, in our region have used it.
Absolutely.
No doubt.
No doubt.
Talk about the ease. You guys, before we came on here today, you were saying that heroin is easy to access.
Yes.
Why is that?
It's cheaper, and it's more regularly available out on the streets. It's affordable. It's everywhere. It's everywhere that you go. TV
shows like Breaking Bad that have come into the mainstream talking about meth and how they cook meth. Is heroin pure? Is it created? Is it synthetic? Is it created out there on the streets, or is it all of the above?
It's all of the above. Synthetic.
Is that what makes it easy to get access to it?
since 2011, we've seen a purer form of heroin available. And prior to that, people were mainly using the brown tar, the black tar heroin. Well, they progressed into using what's called China white, which is a purer form. And it has to do with the refining process and how it's manufactured. But unfortunately, it also, because it's so much more potent, it's leading to more overdoses. So people, I know there was a story in the Blade, in 2011 about this. People didn't realize the jump in potency. So when they started progressing to using the China white, they were ODing without much effort. So sadly, yeah, that's what we're seeing in these more recent deaths, that it's almost always linked back to China white, a more pure form of the heroin.
Talk a little bit about, and we were talking about signs and symptoms and what people who come in to see you. You said there are giveaways. There are definite signs out there to knowing somebody. This isn't an alcoholic. This isn't somebody who's abusing cocaine. Because I was asking you, I posed the question, is a drug addict a drug addict? Is a drug addict? But you're saying there are differences.
Sure, there are different signs to opiate addiction, opiate use, sometimes, manipulative behavior, even in therapy, minimizing the drug use, some withdrawal symptoms, sweating, shifting in your seat, not being able to sit still, chills, avoidant eye contact, those types of things usually are a giveaway. A lot of times there are a lot of family issues that point to opiate addiction.
And it's not an open sign or a giveaway from the standpoint of somebody's going to have track marks up their arms, their legs, because it can be used in many forms, yes?
Yes, people use it in different forms. Some people inhale it. Usually with track marks, it's a little bit difficult to tell because they're hiding it. Very behavior that's hiding the addiction as well.
Talk about the drug itself, Marcia, as we continue. And once again, Marcia Dries and Lisa Beatty joining us from Harvard, talking about heroin, the death of Philip Seymour Hoffman, bringing this back into conversation again this week. Lucas County, the statistics over the last couple of years have just been staggering, and I think that's one of the points that Attorney General Mike DeWine was trying to make when he was bouncing around the state, holding these forums, talking to people about the problems that exist. Some numbers that we got, this was reported back in November when the Attorney General was in town, but between 2010 and 2012, you're looking at just an exponential increase. In fact, 2013 thrown in there, just a 9-month count there as far as the numbers are concerned. But you look at those statistics, they are staggering. Let's break it down easy for people there at home, trying to understand what is heroin at its core. Why is it that people are kind of going this route? And we are seeing these numbers. Then go to the fact that this is killing so many.
Right. Well, they start out, wanting that kind of comfortably numb experience, which they may get through a prescription med or an illegal purchase of what would be a prescription med. And then tolerance gets established. Addiction by nature is progressive. So over time, the person will need more and more to get that same effect, and they become desperate, and they begin doing things they wouldn't normally do, such as shooting up, via IV. Most people would avoid that in normal circumstances because that to them is a drug addict. But basically, they progress into using that, and then they get into the higher forms because, again, they want that euphoria, they want that numbing experience, and they become desperate to get it. Sadly, with Philip Seymour Hoffman's case, they found 40 bags of heroin, 23 of them used in his apartment. So that tells you about the tolerance. His tolerance was probably pretty high. The progression was pretty far along on the continuum.
And I think people have had a hard time wrapping their brains around the fact. They're like, 50 bags, 70 bags, however many it was, found in his apartment. But just as somebody who is taking blood pressure medication needs to have a month supply of that medication. That's the parallel you're making right there, is it not?
They absolutely. They have to have a stash at all times in all places. So, they may be taking that to work with them. They may be taking that out in other places in the community, wherever they go, but they're going to have a continual supply.
Yeah. Why is it that we're seeing, I guess we threw out that statistic as far as an 11-year-old is concerned in the country. Why are we seeing such a young influence?
I think a lot of times it's their friends Their friends.
But 11? Mm-hmm. I've got a 9-year-old at home and a 7-year-old, and that scares the heck out of me.
I've heard a lot of stories where it starts with parents that have opiate pain medication in the home. The kids are taking it, going to parties, saying, here, try this. This will make you feel better. And from there, it's, you know, they can't get the pain medication from their parents anymore. Their parents have found out that they were taking the pain medication, and then they come across somebody who has heroin. And
let me ask you this, and you would know better than I would, but when you cross that threshold in your mind, sadly we have been covering the story over the last year. In fact, this past week, Diane Larson sat down with Brian Hefflinger's parents in Ottawa Hills after the tragic accident there. He was drinking, crashed a car, did not survive the impact. And we look at alcohol and alcoholism and problems with drinking. You think to yourself, physically drinking something may be a little easier than actually crossing that threshold of thinking, I'm going to get a syringe, I'm going to inject myself with this drug. Walk me through how you understand you get to that point. How do your patients, the people you deal with, how do they tell you, or what do they describe as the fact that I got to that point? Is it just just making the jump, that next jump?
yeah, the cravings.
It probably started as alcohol?
For a lot of people, it does start with alcohol. Marijuana is a big one that it also starts out with and moves on to other things. Stressors in people's lives are a trigger for a lot of people to use opiates to give them a relaxing, calming feeling. But as they build up a tolerance and their body is craving the drug so bad, they move on to the heroin.
Yeah. Marcia, jump in on this from the standpoint of crossing that threshold, I guess, of going to the next step of using. I don't know if you call it a more intense, a more serious drug, because they're all in the same category, right?
Sure. Well, there are certainly a number of factors that play into why would somebody progress into addiction. At Harbor, we treat primarily mental health issues. So we know that 2/3 of addicts have coexisting mental health issues, namely anxiety and depression. Mm-hmm. So part of the stressors that Lisa makes mention of, they're trying to escape those stressors, and they're trying to feel normal. So they may gravitate toward it and have a higher predisposition toward it if they have family background as well, more so than someone who doesn't have that going on in their life. So there is a need to look at the whole person, what's going on mentally, physically, behaviorally.
Does it border on, being somewhat masochistic because you're doing harm to yourself?
Well, the denial kicks in. We all have psychological defense mechanisms, so they don't necessarily make that connection in their mind. They've blocked some of that reality. A lot of what we do in treatment is try and break down that denial system and help them to see. You realize what you're doing to yourself. Yeah. Look what's happening to your family. You mentioned it. I'm glad you mentioned the Hefflinger family because they've inspired me in my work. I reference their case a lot because I think the parents have done a beautiful job in their moment of sorrow with trying to convey to the youth the dangers of engaging even in so-called social drinking or other substance use. I think we need to continue our preventative efforts in our schools. I think we need to try and make more treatment readily available to people who maybe it's because of anxiety or depression that they cross into drug use.
I want to talk more about the treatment on the other side of our break. We're going to take our first commercial break. Stay right there. We'll be back right after this here on the Roundtable.